but we're also seeing an enormous impact on providers in a lot of these states because the training that they have been given to provide the standard of care, medical standard of care, is being legally blocked by individuals who have no medical licenses in the legislature.
Hello, and welcome to Disruptors at Work, an integrated care podcast. We are excited to discuss the impact of overturning Roe versus Wade on reproductive rights. I'm Dr. U. Grant Baldwin Jr., your host for today's episode. I'm joined by Dr. Charla Burns, Faculty Associate at Cummings Graduate Institute, Dr. Cara English, Chief Executive Officer and Chief Academic Officer at Cummings Graduate Institute, and Dr. Sarah Shook, Licensed Behavioral Health Counselor at Penn Medicine Lancaster General Health. Today's guests have an extensive background and expertise in reproductive health, which sets the stage for our conversation. Let's get started. Hello and welcome. Welcome to our panelists, Dr. Burns, Dr. English, Dr. Shook. Thank you for joining us today.
Thanks for inviting us.
Thank you for having me. I'm honored.
Great. Thank you. Thank you for taking the time out of your busy schedule. I had some very interesting questions from our audience. Can you provide a brief overview of the current status of Roe versus Wade and how recent legal developments have shifted its impact on reproductive rights in the United States?
Sure. Dr. Burns, would you like to start?
Sure. So going back on June 24th of 2022, the Supreme Court reversed Roe versus Wade, and that basically ended women's constitutional right to an abortion after nearly half a century. So following the announcement, a number of states moved swiftly to enact restrictive laws that have already changed the abortion landscape for women across the country. At least 12 states have banned abortion, and 5 have imposed gestational limits to the procedure as early as 6 weeks. According to the Washington Post, 1 in 3 women in the United States have lost their access to abortion. And in the months to come, more abortion bans and restrictions are expected to go into effect. The problem is this forces women and their families to travel hundreds of thousands of miles to access abortion or to carry pregnancies against their will, which is a grave violation of their human rights.
Wow.
Dr. Burns, I want to add to that just that, women who are in situations where their socioeconomic status is more vulnerable, if they have, less money available, if their social support network is smaller, they are even at higher risk, as are teenagers, because we know that, the vast majority of teen pregnancies involves a teenager as a mother and a full-grown adult as a father. And so many times those teenagers are left with the burden of a pregnancy without any type of support or financial assistance from the adult who created the pregnancy.
Wow.
Sarah, did you want to add anything?
Yeah. So there's another case after Roe v. Wade in 1992, Southeastern Pennsylvania, Planned Parenthood of Southeastern Pennsylvania versus Casey, which upheld the constitutional right to abortion, but also the case really centered around undue burden. And that is another piece that was overturned with the Dobbs decision, is that it removed those protections of not placing undue burden on the individual seeking abortion. So some of the additional restrictions that are being put in place in states that are limiting abortion access really is placing so much undue burden on the individual seeking abortion, such as the required counseling, in-person counseling, who the individual needs to receive consent from to obtain the procedure, and some other concerns as well.
Wow. So this decision has really created a paradigm shift and created a lot of barriers to healthcare scenes. Wow.
Yeah, it's also called into question the accepted definition of what an abortion is.
Okay.
So for many women who are experiencing miscarriage and seek care in a hospital in one of the 12 states that has completely banned abortion or has near total bans, they can seek denials of care or experience delays in care because their doctors are unclear as to what they are legally able to do to provide care. So physicians who have been trained, who have licenses to practice care, to deliver that care in communities, in hospitals that are licensed, are in a state of complete uncertainty. Sometimes their legal team will be confused enough to just not be able to give them a decision. And so there have been women who have had miscarriages in the parking lot or the bathroom of a hospital.
Wow.
There have been deaths due to women who weren't sure about whether or not they were allowed legally to get care for their miscarriage. And so they remained at home instead of seeking care, and they became septic or they hemorrhaged and died. And so not only are we seeing an enormous burden on women in general who are pregnant and uncertain about, the ability to carry the pregnancy to term, the, unintendedness of the pregnancy to begin with, but we're also seeing an enormous impact on providers in a lot of these states because the training that they have been given to provide the standard of care, medical standard of care, is being legally blocked by individuals who have no medical licenses in the legislature. And so they are at odds in a position of being in between the legislature and the law of the state versus the ethical and moral obligations provided by the professional organization. So, as professionals with licenses, we are all beholden to those ethical standards of care. And so we're in a position of asking, what are we supposed to do? Because many people say, well, if it's an unjust law, then I refuse to follow it. But then you are liable for legal ramifications, including being put in prison. Some of the states are now enacting legislation to imprison, disbar, or remove licenses from physicians, and even up to seeking the death penalty for physicians who would aid or assist or provide care for a woman who is seeking that care. So again, it's really produced a horrible life for those of us who work with women in the United States. And I recently moved outside of the United States with my family, and can tell you that no one outside of the United States understands how this is happening. No one understands how both the population and our medical communities are not revolting, because everyone else is looking at this as an inhumane crisis in the U.S. And so, it's really inexplicable.
I just want to piggyback on what Dr. English just said. I am in primary care. And although I'm not an obstetrician or gynecologist, I have a lot of my medical colleagues that are faced with losing their license because they can't provide for their patients, as she alluded to. But I think a bigger part of the issue is miseducation of the population. They don't understand what an abortion is. They think an abortion is just, I'm going to end my pregnancy because I don't want to have a baby. It's much more than that. Yeah. So in legal terms, a miscarriage is considered a spontaneous abortion. So then
and that goes on the medical record, not to interrupt you there, Dr. Burns, but any woman that has SAB, spontaneous abortion, on their medical record could then be considered legally liable, which is why we've got some situations. Sorry, Dr. Burns, didn't want to interrupt you there.
No, and that's a good point. So abortion,
out that impact.
So abortion is not just induced abortion. I don't want to have my baby anymore. Sometimes you'll have a miscarriage, but in medical terms, it's a spontaneous abortion. And then there are legal ramifications that go along with that. So it's just a lot of misinformation. A lot of people don't understand, basic medical care, basic how our bodies work, especially the lawmakers and legislators in this country. A lot of them are just misinformed. They don't know what's going on, and it's just a travesty. That's simply put. So,
And Dr. English sharing that you moved out of the country. I believe it was the Guttmacher that I was reading. 11% of providers have left their state to practice elsewhere as a result of abortion bans. So this fear of prosecution, losing your license. And
Mm-hmm.
Wow.
so it's these providers leaving these areas. Now you have massive maternity care deserts. And
Mm-hmm.
I swear this relates. So if we think back to the 15th to the 17th century and the witch trials that were going on,
Mm-hmm.
people that were providing care and being
Yeah.
accused of practicing witchcraft, like you didn't have to
Mm-hmm.
kill every single person
Mm-hmm.
who was accused to stop that
Mm-hmm.
treatment from happening,
Right.
right?
The
So
chilling
women,
effect
Wow.
is broad.
exactly, you know,
Mm-hmm.
you can be accused of something, and whether or not it's true, it's going to stop
Mm-hmm.
people from acting in ways that they don't want to be, the government doesn't want them acting in, if that makes sense.
Yeah.
So,
Wow.
Yeah, those are great
Mm.
points, Dr. Shook. And one of the states that we've been watching really closely is Utah, because their bans have been so effective,
Hmm.
and they've had to close so many hospitals, and this predominantly and disparagingly impacts rural areas that are already at a loss for providers. I don't think a lot of people who have always lived in an urban setting don't understand their privilege in being able to access providers. But we have two counties in the state of Arizona that don't have a single maternity care provider in those two counties.
Wow.
And they're enormous land masses. So that means you're already having to travel outside of your county,
Hmm.
possibly hours, to get care. If the even close by maternity care hospitals or practices are then shutting down. You mentioned maternity care desert, Dr. Shook, and for those of you who don't know what that means, it means that there is no provider available and no facility available to deliver
Mm.
maternity care in a significant amount of area, like
Wow.
geographical area. So that's another thing. There's lots of places in the world. America's not, the only place that has very rural frontier areas, but those areas generally launch public health initiatives to expand care to those areas to improve access to care. And the United States is doing the exact opposite strategically and by design. So it literally makes no sense. It is in direct opposition of all moral and ethical professional organization codes, not to mention humanity, humane codes.
Wow.
So the healthcare provider shortages were already a problem in America. Burnout is
Absolutely.
at
We
an
were already
all-time
there.
high.
We
Right.
were already
And,
there. Right. Yeah.
like Dr. Burns mentioned, she mentioned she has colleagues. We all have colleagues, I guarantee you, who have, especially in the maternity space, or just who care for women, or gender fluid individuals, LGBTQ individuals, who are looking at moving out of red states and into blue states, or completely getting out of healthcare altogether because of these laws. And you mentioned, Charla, the absolute problem with educating individuals. Public health has always been at odds with how to educate the population, how to
Mhm.
improve health literacy. The United States has taken the opposite strategy to reduce health literacy in the hopes that if people are confused or overwhelmed by the decision, that they will avoid or just not seek care. And that's exactly what we're seeing, which is why we're seeing an increase of deaths. So to circle back to Utah, Utah as a state closed its Maternal Mortality Review Committee because they knew that the number of deaths was going to go up.
Wow.
So they simply closed the committee, and
Hmm.
they are no longer reporting or reviewing
Hmm.
those statistics as part of a CDC nationwide effort. Arizona's Maternal Mortality Review Committee, I've been a member for 3 years, and we continue to review all cause deaths for pregnant people and the year following their pregnancy.
Hmm.
And Utah simply shut it down. That's the response. So again, it just really.
Wow.
Yeah.
This is
Can I just
this,
say one
this is
other
so
thing?
good. Yes, please,
So
please.
you mentioned people moving from red states to blue states. Very interesting because I'm a native of Louisiana, which is in the South, very red. And now I live in Texas, very South, very red. And so there are a lot of restrictions here, and I have a lot of colleagues that are literally moving northern, should I say, or just leaving the country because they can't deal with what's going on in the South or in America. And then it creates a shortage of physicians, which we'll get into a little later in the discussion, but it just makes the problem worse. It's just like an avalanche that just keeps getting bigger and bigger and bigger and bigger and bigger. So that's a political issue. I don't want to get too much in the political side of it, but that's something you have to consider, that rural states, which are mainly in the South, people are leaving because of political restrictions, and then that creates even more of a shortage where there were already a shortage. So I just wanted to reiterate that point.
Yeah. And it's not just providers. Patients are seeking sanctuary. So there are, blue states that are now considered sanctuary states that will allow patients from out of state to come into the state to receive the care that they need. But states are now attacking those individuals for seeking the care that they desperately need with laws that would make it illegal for them to travel across state lines to get it, or even to overreach their own state boundary into other states to legally penalize providers in other states who would provide that care to their state residents. So sanctuary states aren't even safe, so moving to a blue state, that's not even safe. So it's.
Well, I tell you what, all of you have definitely and significantly pointed out the impact of the decision, how the decision affects rural health in underserved areas. Like, as you mentioned, we were already dealing with the shortage. There's several other reasons why we have a shortage, but this is just a whole nother monster right here that is creating, as Dr. Burns mentioned, a whole nother avalanche that you all are giving great insight on that even I was not even aware of. So, and I heard a couple of you mentioning about the marginalized groups as specific people that there's a little bit more impact. And my next question is, how has the overturning of Roe versus Wade disproportionately affected marginalized communities, including women of color? I heard you mention about the low income individuals, but I also want to ask that question as far as the LGBTQ plus population.
Dr. Shook, you want to start?
Sure. So for every marginalized community and like across the board, maternal death rates are higher. You've got folks that are at a higher rate using Medicaid for coverage, which many states do not allow state funding and Medicaid to cover abortion services. So you've got folks that already are having trouble financially. You've got folks that are needing state supports to take care of their health and now maybe living in states that do not provide them access to necessary health care. We're also seeing, this kind of goes beyond the Dobbs decision, but we're also seeing legislation and changes that are not allowing for access to gender affirming care that's going to be happening. So, and back during the first Trump administration, there was also a defunding of some Title X programs that allowed access to healthcare and reproductive healthcare for individuals with low income. So again, looking at LGBTQ plus communities, who often individuals in those communities have lower income and many, many barriers to receiving care. So now that administration had reduced access and funding for Title X programming. And the Biden administration had reinstated some of that programming, but it's taken years to rebuild, and we're looking at a lot of that programming being shut down again, which I feel like an echo here, but it created more challenges for individuals to receive reproductive health care, limited ability for individuals to actually be able to get to the treatment that they needed, limited ability to access contraceptives. So if we're talking how to reduce unintended pregnancy to actually reduce abortion rates, contraceptives are a great way to do that. And there was limited ability to access that. So, for the LGBTQ plus community, there's also all these additional laws going into place and restrictions going into place that are making it harder for them to access care that they need. And all of these things are affecting every marginalized population.
Mm-hmm.
Wow. Thank you for pointing that out. Did anyone else want to chime in on this piece here?
Yeah, one of the things that came to mind is the defunding of Planned Parenthood nationally. Most college students get care at Planned Parenthood at some point in their young adulthood. I myself was one of them. I received my early reproductive health care, women's health annual appointments for the very first time in my life at a Planned Parenthood facility in Arizona. So we were lucky to have one. They provided extremely affordable care. I believe that those annual visits were about $6, which I never would have been able. I didn't have health insurance as a student. I wouldn't have been able to access care at all for women's health. And so the loss of Planned Parenthood is an enormous impact on all communities that lose that type of service, just from the perspective of affordable, high quality standard of care reproductive health for men and women, for gender non-binary individuals alike.
Mm-hmm.
And so, the defunding of that type of service that has happened since the fall of Roe versus Wade has been also an enormous impact. And, one other thing that comes to mind that I see each and every day is just the disproportionate effect of Black women in America who are experiencing and had already experienced some of the highest death rates during maternity and birth, and also postpartum, and are now being faced with an additional burden of worrying that if they miscarry, that they won't be able to access care to keep them alive. So, already fearing having a pregnancy in America, and now fearing what happens if the pregnancy doesn't happen for me? What happens if there's a complication? And so just the totality of that burden for Black women. It's also a higher burden for Native American women, which is something that stands out quite a bit in the state of Arizona. In maternal mortality care review committee meetings when we're reviewing those deaths. And so what you end up seeing is the communities who need care to improve are now having the reduced action for the care that they are either receiving or are no longer able to access. So again, the public health, outcome of that for all of us should be an enormous concern.
It's definitely an enormous concern. And as you were talking, I thought about there are a lot of unwanted pregnancies due to trauma from rape. Like, where do these people go in those particular trauma-induced situations? So
Well, the answer is that in the states with total abortion bans, those states are making it very clear that they intend for there to be no exception for rape or incest, meaning that a 10-year-old who may be under the care of their own father and becomes pregnant through that relationship may have no access to care at all, may be forced to carry a pregnancy to term. Whereas if any 10-year-old walked into an IVF, location, said they wanted to become pregnant, they would absolutely not be allowed to do so. No minor would be. But these are individuals with no exceptions under the law in their state. So it's nonsensical to the degree of ridiculousness.
It's total lunacy. I don't understand. It's like you're blocking someone who was raped or underage. You can't get an abortion, but yet couples that want to conceive, you're blocking IVF. So it's like you're making people who don't want to have babies have them, but then the people that want to have babies can't. And then you're also having to double dip and say, well, you can't get contraception either. It's like, what part of my body is mine?
And none of it is in any way or in any way, shape, or form connected to male bodies. So there's
Exactly.
absolutely no accountability for the male who created the pregnancy. There's no financial responsibility. There's no healthcare burden. There's no healthcare, legal holding a male responsible for an unintended pregnancy or for a pregnancy loss. It is only the female body. So again,
That's
the
complete
implications are
lunacy.
clear. Sarah, you mentioned the witch trials. In my women's health class, we talk about midwives, healers, and witches. A book. I don't know if I'm quoting the right title of the book, but it's a historical coverage of legal action that has been taken across the millennia. To, as you mentioned, legally stop women from providing care to other women, especially around women's health, especially around maternity, pregnancy care. And most of that, again, is looked at as a way to dampen women's own control of their own cycles, their own bodies, their own health, so that males can be in charge, so that
Wow.
males can own the body. So when you look at it through that lens and you really are educated about the history and about how history is repeating itself now, you really can't look at this as a healthcare provider through any other lens than, like you mentioned, Dr. Burns, one of absolute lunacy and utter astonishment as to how this is continuing to happen.
Wow. I tell you what, I'm trying to fix my face here.
Yeah, it's
I'm the
no
host,
no use. There's no
and I
use,
can't.
really.
I'm trying my best, even as a male psychotherapist, and all this. This is just astonishing. Just astonishing. The next question that I have: how have advocacy groups, legal organizations, and state governments responded to these decisions? Are there ongoing efforts to to protect reproductive rights at the federal or state level at all?
There are some states that are enacting shield laws. So
Okay.
Dr. English had mentioned that states with abortion bans are trying to go after providers in like across state lines who are providing abortions. And so some states are enacting shield laws to protect the providers in their states from litigation.
Mm-hmm.
Um, and I think it's 22 states and the District of Columbia have those shield laws. So
Mm-hmm.
that's a positive that's going on.
Mm-hmm. There are also advocacy groups who have pushed for state propositions to get it on the ballot to act to encode um, bodily freedom protections
Hmm.
into the state constitution so that there can be fewer challenges. So several states in the past election won the protections in their state constitution. Unfortunately, there is no national protection for women. We still don't have an Equal Rights Act as the
Mm.
United States for women to be considered full persons equal to our male counterparts. And so there are still federal challenges that can be brought against those states. And
Wow.
when that happens again, to go back to the chilling effect that that has on the health literacy of the population, the providers and their decision making and knowledge about what they're legally able to do versus what their ethical and medical standard of care obligations are, as well as it just kind of creates this dithering instead of everybody just being focused on delivering the standard of care.
Wow. 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 That very, very insightful there. As we move forward, and my final question: what does the future of reproductive rights and healthcare look like in the U.S.? What role do you think the next generation of policymakers, healthcare providers, and activists will play in shaping the future?
Um, I think a lot of that can be answered looking at this last presidential election we just had, where the future is going and what kind of laws will be enacted. Um, I don't see
Yep.
it improving anytime soon. Just to be completely honest, it's going to take a lot of education on the part of the public and people to really understand what's going on to make a change in this country. Again, a lot of people are misinformed. They don't understand women's bodies. It's like they didn't even take biology in class. It's like I'm not understanding where the disconnect is. But the fact that the majority of our lawmakers are males and they're making decisions about women's bodies, again, is absolute lunacy to me. But then also the number of women who co-sign those male decisions is also lunacy to me as well, because it's like it's counterproductive to where we're trying to go as far as empowering women and being protectors of their own body. And I'm just going to leave it at that.
Yeah. Thank you. I just want to say thank you that you nailed it. Honestly, it's women betraying themselves and every other sister on this earth that I don't understand the most. I understand that it is internalized misogyny and self-hatred in a lot of ways, hatred for the divine feminine, within all of us, and hatred for the healing power of women, for the, reproductive power of women, but every human being on this planet came from one of us. And the idea that we would want to, limit the absolute authority and bodily autonomy of one or any sister is beyond me. I'll stop there too.
Boy. Well, I tell you what, I'm astonished, and this is just really overwhelming. I appreciate the insight that each and every last one of you have provided. Thank you, Dr. Shook. Thank you, Dr. English.
Can I add one thing,
You
Dr.
can add.
Baldwin?
You sure can. Go ahead.
Okay. Because I think one of the things that has become really central for me in all of this is looking at the power that we do have when we get really focused and we work together. Because, unfortunately, the group that is pushing this agenda against women having the power and rights that we had under Roe versus Wade is very, very focused on one issue and one issue alone, whereas the rest of us are educated and knowledgeable about a lot of different issues that are affecting social justice, healthcare outcomes, public health outcomes, and we are often distracted by many different topics. But one thing is very, very clear, and that is that the lives of women are in jeopardy in a way that they have not been since Roe versus Wade made the protections that it made. So we must, as a medical community, come together and stay extremely focused on advocating for the care that women need and the rights that they deserve to stay alive. And we have to just not shut up about it. We can't take a sideline. We can't look at this as a political issue. It's a life and death issue for us, for our daughters, and for generations in front of us. So, we just can't stop talking about this. We have to get it out there. I think a lot of people in medicine with a license are afraid to talk about this because it seems like a political issue, and people, are like, I don't want to talk politics. But at the same time, they made it political when they came for us. When they said, your rights are less than mine, they came for us. And as individuals who have been educated far, far, far further from these individuals who are being paid to make the legislative decisions that they're making, we just can't stop. We just can't give up the advocacy that has to be done to win the rights back. The pendulum will swing, but it's only going to swing if we keep working together and we stay focused and we don't let the other side distract us, because they're really good at doing that. They're really good at making us feel divided. They're really good at making the news seem like there's a lot more people in support of what they're doing than there really is. So, we can definitely continue to work together to make laws, to influence policy, and, to work in our own states in those capacities wherever possible. And we have to reach out to other healthcare providers who understand this and get it so that we
Mhm.
can accomplish those things.
Absolutely. Absolutely. Thank you
Go
for
for it. Go for it, Dr. Burns.
So
Dr. Burns. Go ahead.
again, I love Dr. English. Like, she is just laying it all out there, but it's going to take all of us. It's going to take men,
Yes.
women, Black, white, Latina,
Yep.
other, LGBTQ,
Yep.
whoever. It's going to take all of us in this fight to get the rights back. And it's mind-boggling how far we've progressed and then gone backwards. It's like we've done nothing.
Yeah.
And it's going to take all of us. I am a woman. I am a Black woman. I am a Black woman who lives in a rural state, and I have a goddaughter to think about. What is the landscape of this country going to be when she turns 18 years old? You know, what kind of rights will she have? That's personal to me. That's personal to me, my family, my community. The young girls that I mentor in the community, they look up to me. They see me as a role model because a lot of them don't have motherly figures. What is the world going to look like for these young ladies? And the young men too. They're just as important.
Yeah.
They play an equation in this, you know, but it's the women that are the ones that are being really held accountable. The men play a part, but they're skating away with a lot of the responsibility. So it's going to take education on the part of everybody, and it's just a group effort. So I just really want to say thank you, Dr. English, for really, you know, saying what needed to be said as far as that goes.
Yeah. Dr. Shook, anything you want to add?
Yeah, it's going to be a tough 4 years at least of advocacy and watching some protections and benefits that we had be dismantled. And you know, Dr. Burns, I think to your point, we need everyone to know that this is something that impacts all of us. This isn't something that we can do as individuals. We need everyone to agree that this is healthcare, this is necessary healthcare, and to advocate for the ability to receive this healthcare.
Okay. Thank you. Thank you, Dr. Shook. Thank you, Dr. English. Thank you, Dr. Burns. Thank you for taking the time out of your busy schedule and sharing your expertise. This is a subject that that was mind-boggling as I was seeing the year coming into the end. And thank you for bringing this topic into fruition and helping answer some of the questions that many of us had in our audience. And just thank you for taking the time to enlighten and educate us on what's going on currently and give us insight what we need to do as a community, collectively working together to improve access and increase access to healthcare. So thank you for coming.
You bet.
Thank you so much.
Thanks for having us.
Thank you.
I'm glad to be here.
If you enjoyed this episode, don't forget to subscribe and share. Let's keep disrupting healthcare together. Until next time.